So there are a couple of things I want to comment about your numbers of the people who are satisfied with their health care. Well, whether or not it's true that a minority of people are displeased with their health care, there are two factors to consider here. The first is the severity of their disappointment. Okay, now it's estimated that about 45,000 people a year die from lack of health insurance. That's about the same as the number of people who die in automobile accidents. Okay, it's pretty well up there. You consider it's a major cause of death in this country. People who can't afford their health insurance, who get denied, who've got pre-existing conditions, they just can't get the health insurance, and they can't get the treatment they need, and they die. Okay, those people are pretty disappointed. The impact on them is pretty severe. It's got an economic impact on everyone. Okay, the number of foreclosures in this country is about 42,000 a week, and about 60% of those are due to medical costs. People have, they're forced to choose: do I pay for the mortgage, or do I pay the medical bills? Well, they pay the medical bills, and they get foreclosed. Okay, they can't afford to keep the house, and in this market, they can't sell the house. They're just stuck. So it's contributing to the worsening of the economy. These healthcare costs, these people are having a very negative impact on the economy. Okay, because they can't get health insurance. The health insurance companies don't care about that, though. Any sort of social cost, they're all for externalizing that. They want to externalize all the losers. Okay, that's what they want. They only want to have deals with the winners. The people who don't need health care are more than welcome to buy health insurance. The ones who need it, stay away. Okay. The second thing to consider is that the changes we're proposing to health care are not that drastic, especially not the things that are the most contentious. The idea of a public option, I don't understand what the big deal is about. It's not going to fundamentally change the health insurance market immediately. It's something that will kick in eventually, and if health insurance companies refuse to compete with the public option, well, then they're goners. Okay, but this idea that the public option is government takeover is just so far-fetched. The only purpose behind the public option is to make private insurance compete, especially in some of these markets where they've got virtual monopoly, where they're the only game in town, and they can charge whatever they want. Now, especially considering the fact that part of the reform to eliminate pre-existing conditions is going to compel and mandate people to get health insurance. We need some way of controlling costs. We have to have some mechanism in place to make sure that the health insurance industry is competing, okay, to lower the cost. And I don't trust them by themselves to do that at all, especially not when we're going to be compelling people to buy their product, whether they like the price or not, okay? So the public option is such a minor thing, but the health insurance companies understand that what it really means is that they're going to have to compete, and they don't want to have to compete with the public option, and that's why they pointed all their guns, all their ammo at that. They've conceded on nearly everything else. The one thing they don't want is competition, okay? And that's the one thing that we need in that market if we're going to lower costs. But we're not talking about fundamentally rearranging the whole healthcare industry. We're talking about restructuring health insurance and injecting competition into that market, okay? That's what we want, and it's not a major change. So the fact that a majority of people like what they have now. Well, they're not being forced to change anything. They're not being forced to change. What we want to do is offer an option, offer something different for those people who are displeased with health insurance, okay? It's all about choice, okay? And it's funny to hear you say that because 60% of the people like the health insurance we have now, that they should not have the choice of a public option. It's just, the irony is tangible. That's all I'm going to say for now. Thanks. Bye.